Tim. All right, and Tim, where did my friend Tim go? Let me bring you back. Why is there two Tims? There you are. There's two of you again.
You can't handle more than one of me, Michelle.
I know, you're too much. All right, so thanks everybody for sticking around. If you, oh, it's Chuck. I'm like, wait, who is that? That's not Tim. Let me change you to Chuck. Hi, Chuck.
Hi,
I'm going to rename you to Chuck. Okay, so thanks everybody for sticking around. Thanks everybody for joining us for that amazing CLE with Fern. We are quickly transitioning right into this non-CLE, but we could give you a lot more information that could be very beneficial to your actual health. So maybe even better than CLE credit. You never know. If you're like sitting out there right now, desperately needing a dental implant, this could be even better than CLE credit, I would say. All right, so I'm gonna let Tim take over, or Chuck take over.
I'm gonna let Tim take over. Go,
Tim's
Tim.
taking over. Take it away, Tim.
Well, thanks, Michelle. Thanks, Chuck, everyone, for staying on the call and listening to insurance information on a Friday afternoon. Well, thank you. We're excited to roll out the SmarterBenefits platform to the Academy. And we had some really nice results. What I wanted to do right now is walk you through some of the tools you have access to on the self-service side. So we do have a full service call center. You're seeing marketing going out, but a lot of times you want to be able to look and review plans before you make that buying decision. So I wanted to walk you through the broker exchanges platform that you have access to. So I'm going to share my screen real quick and give you a little bit of an overview of what's available, how to review it. You can buy a lot of these products directly on the website, and then also give you access to the call center phone number through here as well. So this portal gives you access to review your dental, your vision, the medical plans that are out there, some lifestyle and prescription offerings. So I'm going to spend time on the dental, vision, and medical coverages. So you can go through and get a custom quote for you. You're going to put in what you want to look at. We'll talk about dental, vision, and major medical. Who needs coverage? So this is particular to you as an employee, or you as a member. Do just me. We'll use a New York zip code since we're talking to lots of New Yorkers. It's my birthday. And with this simple tool, you can review all the plans that are out there. So a couple of things to point out about the plans that we offer. All of these plans, there's no age limitation, there's no waiting periods, there's no excluded benefits. So if you needed a dental plan, if you needed to get some major services done, or want to make sure you have the strongest plan out there, that's a solution we're offering here, is the ability to kind of look at all these options that are available for you. So I'll take a little time to talk about the MetLife options. So the MetLife options, they range from a platinum plan down to the silver plan. The rates will change according to your location, but I'll show you some of the plan features. What you're going to see is a rolling open enrollment. So you can enroll any month you want. As long as you enroll by the 18th of the month, your coverage starts the 1st of the following month. All of these plans are national PPO and are really benefit rich. So a lot of the plans you might have access to in the open market today are a little bit less rich of benefit. Maybe there's waiting periods, there's excluded benefits. That's not the case with us. On this platinum plan, it's a $3,000 annual maximum, meaning that MetLife will pay up to $3,000 on your behalf for dental care. It doesn't matter what you use the prior coverage or prior carrier. We cover start at $1. This plan also covers orthodontia for any child under the age of 19. So you have a kid that needs braces, it's a really good option to help offset some of those costs. It outlines all of the services, what's available, what options you want to see, make sure that what you need to get done is covered. If you look at the major services, it covers implants, it covers extractions, it covers dentures, it covers all of those major services the first day you take the plan, you're eligible for the plan. So make sure you know that when you're looking at these plans, there's no red tape, there's no gimmicks to these plans. These are very strong national offerings. And once again, it doesn't matter if you're in New York, you're in California, or anywhere in between, you can get access to those services anywhere you go. This middle plan, this gold plan, is probably one of our top sellers. The same thing, it covers all of those major services, just doesn't cover orthodontia. So if you don't have a child that needs ortho, this is a great solution at a much lower price with a $1,500 annual maximum. So I encourage you to visit the site. It is posted on the Academy site, so you can absolutely access it through there. Or I'll also put the link on the chat, so if you want to look up the site through the link, that's absolutely possible as well. You can buy directly through the site as well, and I'll show you that experience shortly. In terms of other options on the dental side, the Solstice EPO, what this will give you access to the Solstice network, and you'll pay the discounted rate of Solstice without any type of caps on your plan. I wanted to point out this plan, this Dental PPO 3000 plan. We just showed a MetLife plan that had a $115 price point for a $3,000 benefit. This Solstice plan is almost half, is about 60% of the cost. With the same level of benefit, it just does not cover orthodontia. So if you really like that benefit level, but you don't have a kid that needs ortho, this is a way to get the exact same levels of benefit without the orthodontia rider, without significant savings to your price. On vision, vision is a really strong benefit to have. Anyone that wears glasses, that gets the annual checkup, this is a really smart option. This is for routine vision. So the vision plans is for your routine eye exam, your lenses, your hardware, your frames, all those kind of good things, and contact lenses. The low plan is a $15 a month cost. The high plan is $23 a month. The biggest differences come down to, on the low plan, it's a $20 copayment at the optometrist for the eye exam. On the high plan, there's no copayment, and you can get your hardware, your frames, and things like that every year versus every 2 years. If you scroll through the site, you'll see it shows you all the levels of coverages, what your copayment would be for the certain types of lenses that are out there, because there's a lot of options available, some of the enhancements that are available, and some of the reimbursements or allowances that you have for some of these major types of glasses, these glasses and some of these features. So I would encourage you to use the site to make a good educated decision before you call the enrollers. The nice thing as well is that you can buy through the site. So you can buy any product on the site except for major medical, which I'll talk about shortly, by a click of a button. You add it to the cart. Let me go through the medical first. On the medical plan, we have offered 2 national PPOs. The really strong thing about these plans is that they are national. They are PPO coverage. They have in and out of network benefits. These plans are rated, are composite rated, means it doesn't matter about your age, your gender, how many kids you have. The rates are going to be the same regardless of those factors. These plans are extremely competitive in New York. To be able to get a plan that has a $350 deductible for under $1,000 in New York is almost unheard of. This Blue Card 2500 is our top selling plan. You would have to call my enrollers before you actually enroll, because there's a medical questionnaire with this. Make sure that you pass if you pass the medical questionnaire, you have access to the plans. Before you buy, you have the ability to look up your doctors by clicking on the link here. This will take you to the provider search for Blue Cross and Blue Shield and the national PPO network. Review the benefits, what deductibles are, what the co-insurance is, so that's how much money we pay in percentage after the deductible, what your maximum out-of-pockets are, so the most money you pay in a calendar year towards your benefits. What's different about our plans versus if you buy an individual plan is the office visit co-payments are not subject to the deductible. So if you go to the primary care, you go to the specialist, you pay a co-payment with no deductible. If you go to a urgent care center, you pay the primary care copay of $40 and you go to the urgent care. Chiropractic care is covered. The other thing to point out too, on outpatient mental health, if you go see a therapist, on the 2500 plan, it's deductible and co-insurance. On the high plan, the $350 deductible plan, it's a $35 copayment. So once again, there's a lot of details within this site to make sure that you have the ability to make a good informed decision about the plans that are available. Prescription coverage in all plans. So generic medications are free. Your brand name drugs that don't have a generic equivalent, you would pay 25% of our discounted price. So you'd see some nice savings on your plan versus what you pay today. And non-preferred drugs, these are drugs that they're a name brand drug, but have a less costly alternative. You pay 50% of the discounted price. If you want to get the medication for free, there's usually a generic available. So once again, give the ability to make a good informed decision before you buy coverage. And all these plans include a small amount of term life insurance. On the life insurance side, we offer $150,000 of guarantee issue term life insurance. You need to contact the call center to enroll in that. The number is here as well. Also, we have additional products and lifestyle products. So standalone tech support, standalone identity theft, pet insurance, and telemental health. So if you wanted to talk to a therapist, you don't have one that you work with directly now, maybe you're uncomfortable in that process. Mental telehealth is a $35 copayment, $35 a month with unlimited utilization. So once again, giving you the tools to get access to high quality benefits from the comfort of your home. If you wanted to make an appointment, you could call the 877 number listed above, schedule an appointment with one of my live enrollers, and talk about the details along the plans that you want to talk about before, when you want to enroll in those plans. But once again, these are all available to you today through the Academy's Smarter Benefits platform. This site is bilingual, English, Spanish. We have a mobile application and a member login for your portal. So if you buy any products with us, you get access to our portal where it takes all the information, ID cards, EOBs, all the things to make sure you can access your plan are available through our site directly. Let me see, I think I might have a couple of questions. Let's see, there's a Tim question. Yep, so absolutely, so you can search your doctors. I'll walk you through that again real quick. Is that if you go to search your doctors on both the Cigna and the Blue Cross networks, for Blue Cross, you click on this link, you put in your address. I'll just use a New York zip code. This code is LBT. We'll post that on the site as well. And you can look up your doctors. I would say do your search is broad and then narrow it down for the best results. For Cigna, the same thing. You click on the Cigna logo. Put in your zip code. And then you'll search providers the same way. This is the Cigna PPO network. So make sure you're looking at it. If you're looking at your plans before you make your decision, make sure your doctors are in. Which would be? There's Invisalign. Invisalign is not going to be underneath the orthodontic. That's more of a cosmetic, procedure. There's a better coverage for that on the Delta on the Solstice product than there is on the MetLife product. Is vision strictly for eye exams, eyewear, or ophthalmologist? The vision plan is for your routine preventive vision. So if you need to get an eye exam, you need to get glasses, that's going to be covered. The medical plan will cover medical conditions with the eyes. Teeth whitening is considered a cosmetic surgery, is a cosmetic procedure. There are discounts on both of these as well for both these plans for both Solstice and MetLife. So there is discounts for teeth whitening. What is the best of obtaining a high deductible policy and signing up for an HSA? We have a strong HSA option. If you go to the medical plans, go to the Anthem plan, and you have the Anthem, the Blue Card HSA. So it's a $6,750 deductible. All services are covered at 100% after that deductible, and it's an HSA compatible plan. Yes, there is plan. All these plans we can put together for a small group or a business owner. So we could put together a group plan using these plans, and you could mix and match the plans and networks to whatever ones you see fit for you and your company. Any other questions or anything, Chuck or Michelle, you may go into a little bit more detail on? I wanted to make sure I kept it moving on a Friday afternoon. I'm sure insurance is probably the last thing people.
Yeah, I
want
was
to
just answering the HSA question in the chat, but I'll just mention here that the question really was not what is the HSA, but what is the advantage of an HSA? The advantage of a health savings account is that you put away money that then becomes a tax deduction when you do your 2021 taxes. So the money that you're funding into that health savings account is pre-tax money that you can use to pay for your medical needs, for your office visits, for your prescriptions, for a whole host of things. You can look at irs.gov for, I think it's publication 960, or just go to hsastore.com and they'll show you all the things that they'll sell you with your HSA funds. And it's a ton of things, including, I think, sunscreen and Band-Aids. So it's very beneficial in that regard.
And if all this just like felt like too much and you were like, oh my God, I don't know, how do I find that HSA card again? What? Just call Tim, just call this number and Tim will magically walk you through it slowly and specifically for exactly what you're looking for. So we're trying to give you a pretty broad overview. There's a lot of stuff in here. So if you take the time to just give these guys a call or set up a time with them, they can really narrow it down for exactly what you're looking for. You can, tell them how many people you are, tell them where you are, what kinds of services you're looking for, and they can give you a much better narrowed in view on what you want to know.
Exactly. I mean, you use the site for your basic information. Look up your dentist, look up your doctors, look up your eye doctors, things like that. And if you have any questions, your personal questions, my enrollment team does a great job. Schedule some time with them to make sure they have the right answers for you. And call as many times as you need. We're here for you guys 8 to 8 Monday through Friday. So that number on the top of the screen is the number for your call center. The question of how are the plans billed? The health plans are billed via an ACH direct withdrawal. So we put in your bank and we withdraw it monthly from your account. Some of the other less costly alternatives, the dental, the vision, some of the voluntary products can be billed either ACH or via credit card. If we have a small group, we can bill it to the group as well. So the flexibility in billing is very, very strong.
There's also a question, are the plans available for solo practitioners? The answer is yes.
Absolutely. And Alan, that's a great question. I'm glad you brought it up because that's really the focus here, is that this is a group of a lot of solo practitioners that might be stuck on some of these, less desirable individual plans. And that's the purpose here, is to give everyone access to high quality plans, not just mid-sized groups.
And that's because the Academy is awesome. So you're,
No
if
question
you're on
about
Team
that.
Academy,
No
then you get access to awesome stuff like all my friends like Chuck and Tim and Fern. All right, well, check out the website. It's pretty easy to remember if you just go to trialacademy.org/SmarterBenefits. There's a link to it also on our homepage. I think it's one of the news scroll things. Or you can always email us info@trialacademy.org and I will be happy to get you connected with the right peeps. All right, and we are actually going to do a couple more of these sort of quick right after a CLE, give you a little bit more detail. So we're going to do this for the next 3 CLEs. So if you're attending any of the upcoming ones and you have more questions, there'll be plenty more time to pepper Tim and Chuck with your questions.
Pepper away.
Specific health plans, dental plans, vision plans. So get on your CLEs and make sure that you tune in, because we'll give you the information that you need to make these good decisions.
Perfect. All right, awesome.
Thanks
so much, guys. Thanks,
Thank you so
everybody.
much.
We'll see you soon.
Thank you.
Bye.